And it's thanks to this solidarity yesterday that we were able to hit this record. But I would like to mention, as many people are seeing, I want to say this to Daniel and to his team and to the entire network. I think that we have something to be proud about with our government machine that adjusted to this vaccination effort. And I think that Quebecers can be proud of what the network has done. And I want to thank them. Now, the topic today is truly the question of priority groups. Up until now, you'll remember that we had opened up vaccination to groups 8 and 9. We did this in the last week. Group 8, I'll remind you, these are the groups of people who have chronic illnesses but who needed follow-up in the hospital. Now, before we open up to the general population, given the new vaccines that we have available, which is very good news, we have two groups that we can consider as being more vulnerable, but who were not included in the initial announcements that we made in Category 8 and that we can now prioritize. And these are people, and these two groups are people who have severe chronic illnesses, but who don't need a follow-up in hospital. But it's also people living with a disability who either have a physical or mental disability or who are on the autism spectrum. Since we have new vaccines, particularly the Pfizer vaccines, with additions every week in May and June, we can now, with the recommendation of public health, broaden up to other more vulnerable groups before we go to the general population. So now we are opening up or adding chronic illnesses. So for chronically ill people, we're thinking, and I'm just giving you practical examples here, respiratory illnesses, people who are diabetic, and people who are obese. And I'm repeating, these are just examples that I'm giving you. There's a list. There are several chronic illnesses, but there's a detailed list on the website, and I think that most reporters have already received this list, and it's available on our website. And all Quebecers can go read this list in the next few minutes. But at the same time, what I would like to say is that we are counting on the solidarity of Quebecers, of people who find themselves in these categories. You recognize yourselves, you know who you are. And it's important to mention this because we do not want that people who are on site in our vaccination centers, that they have to play the role of a police officer. If you are in a situation that, in your opinion, means that you have a chronic illness and that one of these illnesses that you see that you have one of these illnesses, I would like to tell you, do not hesitate to make an appointment. We are relying on the good faith not only of those who have these chronic illnesses, but we are also relying on Quebecers who are not part of these priority groups to wait a little bit longer. And we're not talking about months here. We are talking about a few weeks only. So for us, I think this is a major announcement. We have increased or broadened the group of people who can get a vaccine. So out of these people in Quebec who have a chronic illness, during the last announcement for Category 8, we had approximately 200,000 people who were impacted by this. Now, we are adding today, I would say, at least 300,000 people, 300,000 additional people who have chronic illnesses. But when we add also all of the people who are 60 and up that we've already treated, well, that's 500,000 people. And I think that we are doing the work that people expected of us. And I'm repeating myself, it's truly thanks to the fact that we now have the opinion of public health that has adjusted itself, but it's also due to additional vaccines coming in. Now, people with a disability, people living with a disability, the other group that we want to prioritize before going to the general population are people who have an intellectual or physical disability. By this we mean a disability either whether it's language or hearing, we want to be as inclusive as possible, or for people who are on the autism spectrum. There were a lot of questions on this, and we are very comfortable including this group. Now, once again, to give you important numbers, this represents a pool of 200,000 people. Earlier, we said that we were adding approximately 300,000 people for the chronic illnesses, and here we're adding another 250,000 people as it pertains to people who have an intellectual or physical handicap. Now, the good news, and given the vaccines that we have decided, and we're very pleased with this recommendation, to include caregivers. Because one of the issues that we had, and we listened to the population over the past few days, particularly when it came to people who had a physical disability or an intellectual disability, it was how do we get to the pharmacy or to the vaccination center for those who did not get treated in the hospital. Now, once again, we are being adjusted and we are adding caregivers. So that means that this category is adding not only 250,000 people, but there will be at least one caregiver for each one of these people who will go get vaccinated. So this category requires that we put aside approximately 500,000 vaccines over the next few weeks. And I know that Quebecers are anxious to see the general population get vaccinated, but I think that we also know that Quebecers
longtemps des choix difficiles, puis je pense que de mettre en priorité et de terminer nos personnes les plus vulnérables, c'était le bon choix à faire, puis c'était surtout le bon choix à faire
to make with the new vaccines that we have obtained in the last week. And what allows us to do so, and I'll end with this, is truly because of the regularity that we have seen with the arrival of Pfizer vaccines. They're coming in every week, and now that we know that we'll be getting additional vaccines, well, we were able to make this decision. I would also like to talk about mass vaccination because I know that you're anxious to hear about this. You've seen our sites are ready, the staff is ready. We're only missing the vaccines, but I will let Mr. Paré talk to you a little bit about two wonderful initiatives that will see the light of day as of next week. But before handing it over to him, I would like to remind you how important it is to thank Quebecers who have stepped up. We are moving forward well with the vaccination, but we want to make sure, and I'm repeating myself, that our vulnerable people can be vaccinated first. I'm relying on Quebecers. I'm sure that we'll be able to well manage the next few weeks. And I will hand it over to Daniel for the announcement of this wonderful initiative. Thank you, Mr. Dubé. Like the Minister mentioned, we are continuing to get ready to vaccinate all Quebecers to reach our objective by the 24th of June. And as of next week, our first sites in business places will start vaccinating. We've got 2 sites that are getting ready. And this is something that will increase our vaccination capacity. It will increase our capacity to make sure that everybody can be vaccinated, as stated. The second objective, of course, is to be able to reach all groups. So we have to modulate our vaccination approach. We have to adapt it. And next week, we'll be able to announce our first big drive-through vaccination project. And we think that this is a new way of reaching certain groups without appointments. So these are 2 wonderful initiatives that we believe will really allow us, once again, to increase our capacity. With the wonderful news that we got yesterday, you saw vaccination over 80,000 people. We demonstrate that the capacity is there when we have the vaccines, but we want to be ready for any situation. We're continuing to increase our capacity in order to reach our objectives. And once again, if we have we got other wonderful news from Pfizer, and if they have more vaccines for us, we will be ready to increase our pace. We will now go to the question period. Question.
Commençons par la vaccination.
If we start with vaccination, I got some messages. I know people are already getting their dates for their second dose, and it's in the middle of the summer. They already know that they won't be there. Do they have to come back here? Can they change the date? Does it become a problem? People will wait so that it doesn't fall into the middle of their vacation. Is it an issue? Is this something that you're managing now? I would like to say that vaccination is a privilege. We are in a pandemic, and we're giving the first dose and second dose so that we can be well protected. This is not a luxury, and I think that's the first thing that we must mention. For logistical purposes, we will adapt for some reasons. For people, we can understand that there might be work issues or there could be health issues, and over the next few weeks, we will announce some processes in order to change, let's say, the date of the second appointment. But my main point is important. It is a privilege to get a vaccine, to protect ourselves, and I would say that it's a civil responsibility. Can you talk to us about the hospital capacity in Quebec and Chaudière-Appalaches? It's been 3 weeks that just about everything is closed, and it doesn't seem to be getting better. Well, the first thing, and we've explained this, and I'm happy to hear this question actually, because Quebecers are following very closely the number of cases. And we've seen in the past week, the number of cases has decreased. So that's the good news. But you know that unfortunately the number of hospitalizations, and particularly in ICU, follows 10 to 15 days after the new cases. And not that long ago, we had more than 400 cases in Quebec. And I'm repeating myself here, but today we are paying in our hospitals for what happened 10 or 15 days ago in Quebec with over 400 new cases. That is why the first piece of good news that we've got right now is to see the decrease in cases in Quebec. But before we see the impact on hospitalizations and on ICUs, it's going to take a few more days. And I know that Quebecers are following this closely. I think that the media is helping us quite a bit to get the message through. But I would ask you, and I'm asking Quebecers, to look at the number of cases, but the number of hospitalizations and people in ICU. But if if the trend is maintained, the cases have decreased, so we should have an improvement when it comes to hospitalizations and ICUs. Except that, contrary to the first and second waves, the variants are much more present. So people who go into the hospital or in intensive care stay there a little bit longer than what we saw in the first and second waves. And that is why we appreciate that Quebecers are so careful right now, because it's our health network that is having a hard time with the new variant. Question? A question concerning the Indian variant that was detected in Quebec. We know that it seems to be more resistant to vaccines than other variants that we've seen. So where are we with this? Will we put in place some specific measures, specifically where the variant was found? Well, we'll listen to our expert. Essentially, what's the good news is that we were able to detect this variant. I had some discussions with people from the public health lab, and I would like to say that this is an Indian variant. It's true, but it's not necessarily the same. It is in the same family as the Indian variant, but it doesn't necessarily have the same mutations as the one that we're seeing in India right now, which has other mutations. And I don't want to get into the details here, but that means that it comes from the same generation of strain, but it doesn't have the same mutations. What's happening in India as well currently is that there's a circulation of that variant, but there was also an easing of measures. There's no vaccination, and that means that the impact of the Indian variant, which emerged quite recently, is certainly there. It's a variant that is more contagious, but we are not able to compare it that much. And as it pertains to vaccination, well, it's a bit theoretical. We don't yet have precise information on this. Regardless, what is important is that we have an aggressive attitude when we intervene, whether it's an Indian variant or another variant. And to date, the person where we detected by sequencing this variant is doing well, and all the people around this person will be or were screened. They were isolated quickly, and there doesn't seem to be any other transmissions, but it could happen. And it would even seem that the Indian variant that we found in Alberta is not the same strain that we have here in Quebec. So it's a situation, well, the first thing is the measures that we're putting in place are good for all variants. The aggressive approaches that we have in terms of public health allow to control the transmission of the virus. That's why we're very aggressive. And we have a system that will be able to detect through sequencing, random sequencing, or in certain conditions, people who come back from travel, or people who were reinfected following vaccination, that will allow us to detect the progression of the variant. For the time being, I think that we have to keep an eye on it. We have to be prudent, but there's no specific measure to put in place in the city or in the territory where this person could have contracted the virus, but it's still being investigated. I understand that we're opening it up to people with chronic illness, a specification. There'll be some vaccination without appointments, but will we also look at pregnant women for priority vaccination? Well, pregnant people, this is something that public health is looking at, and I would like Horacio to comment on this. Pregnant women who have a chronic illness, for example, a diabetic pregnant woman or a pregnant woman who has badly controlled hypertension, the indication is there, she will be vaccinated. But for the pregnant woman, what we're asking is that they talk about it with their doctor. There are health workers who were pregnant and who were vaccinated. And when we have a new vaccine, pregnant women are always a concern that people have. But several authorities, scientific authorities, in gynecology or other specialties are recommending that we vaccinate pregnant women, but we will proceed with the most vulnerable, the ones that have chronic illnesses, and then pregnant women will be able to get vaccinated. Concerning your question on vaccination of people with chronic illnesses without appointments, I would like Daniel to comment on this. Yes, we will open many appointments over the next few weeks to make sure that all people that we've just announced today, that Mr. Dubé announced, will be able to get an appointment. We prefer to go with appointments. It's solid data, especially for people who are more vulnerable. They know what time to show up and get their vaccines. So that is what we prefer for this priority group. We prefer to proceed with appointments. Could you give the dates for the two categories? Very good point. So the opening for people with chronic illness, as of tomorrow morning, 8 a.m., people will be able to go on Clic Santé to register and make an appointment. For people, for the group of people living with a disability, it's going to be as of the 28th of April, next Wednesday. Same thing, they'll be able to take an appointment on Clic Santé or call the number 1-877, the number that we've already announced, for people who can't go on the Clic Santé website. And they'll be able to make an appointment. And as I said, we're going to have enough appointments for these groups. The reason why I wanted to specify this is to give our people living with a chronic illness to have priority over the second category. So by opening up the appointments for tomorrow morning, that gives people 3 to 4 days of priority over the new appointments that we're opening up, so that after people who are living with a disability with their caregiver, they can start as of next week to get an appointment. So we're relying on people's good faith. Exactly. Question. Mr. Dubé? Nouveau Info said this week that there was a phenomenon. Hi, I'm always on the site here. Nouveau Info said this week that there were vaccine hunters, as we're seeing in the U.S. So young people who are not in the categories who can wait for hours, but they manage to get 5, 6 doses at the end of the day. We don't want to waste the doses. So what do you think about this phenomenon? And is it a good thing to do? Or should we prohibit that, but we don't want to waste the doses? So what do you think about this? I'm going to let Danielle answer that. When it comes to callback lists, I think it's important to take advantage of your question to talk about this. We know that with the vaccines that we've got currently, these are frozen vaccines that must be prepared, etc. People do this very carefully, but yes, sometimes at the end of the day, we may have remaining doses, and since the vaccine is so rare, we want to make sure that we give them out. So each one of the establishments, they have a list of people, and it's mainly with employees in the network and their priority groups. And we want to make sure that we don't lose the doses, but it requires accessibility for people. They must show up within 25 or 30 minutes of the site because we know how many doses we've got remaining before, the site closing down. So to answer your question, to have callback lists like that is a good practice so that we don't waste any doses. I'm not aware of that phenomenon. We have asked establishments to have these lists so that we don't waste any doses, and these are people who are in the priority groups that we've already targeted. If you have specific examples of certain regions, I would like to know so that we can give Mr. Paré, so that we can ask him to do the necessary verifications, because for me it's important to use these callback lists. But if that is a practice, I don't know about that practice, and Daniel either from what I understand, but if ever you've got some examples, well, we need to know. The Christophe Colomb Clinic, amongst others. Is it a mobile clinic? We just have to be careful because often in the mobile clinics, it's even more difficult because there we've got different populations, but we'll look into it. Mr. Arruda, the Johnson & Johnson vaccine, we were supposed to get the first dose at the end of April. 1 dose was supposed to be sufficient. Now with AstraZeneca, it's the same principle with the blood clots. So what's happening with Johnson & Johnson in Quebec? Well, we have to understand that we have the impression that we'll get the same type of issues as we have with AstraZeneca. The data is being gathered currently, so its use will be recommended for a certain group of age for which the benefits on health outweigh the blood clot issues.
Oui, bonjour.
Question?
Juste une précision, parce que je suis pas certaine de...
I'm not sure if I understood correctly. As it pertains to the vaccination, you're not asking for any proof. Contrary to essential workers, on the Clic Santé site, they were supposed to indicate that they were essential workers and that they were supposed to bring proof from their employee. In this case, for example, they don't have to bring a prescription, or nothing is being required. No documents are being required. No, we're really relying on the good faith of people. We're talking about people who have chronic illness, and we're talking about people who have a disability, either intellectual or physical. Well, diabetes doesn't always show. Yes, but I know that given the opportunity that we have now, and it doesn't take anything away from people who are in the 9 category. We're talking about essential workers, teachers. It doesn't take anything away from them. What I'm saying is that now that we have the opportunity, we've got 900,000 additional vaccines. We believe that by relying on the good faith of people and by prioritizing those who have chronic illnesses or disabilities, I think it was a right decision to make. And the role of our vaccinators, of our evaluators, is not to be police officers. And I think that where we are now, and I appreciate the question, and I would tell you, where we are in our vaccination campaign, if we had not done this, we would have opened up to the general population a few weeks earlier. And that is why earlier I said that I appreciate the efforts that Quebecers have made to understand that now we prefer to give an additional opportunity to people who have these chronic illnesses or handicaps to be vaccinated before them. So I think that people will understand that we're relying on their good faith, that we're relying on the good faith of people who have chronic illnesses or disabilities, but also other Quebecers will understand that we're just a few weeks away from having the vaccination for the entire population. I would also like to know, when it comes to the vaccination of young people, because Pfizer is saying that its vaccine is safe for young people as of 12, Health Canada is evaluating it with all everything that we're putting into research. So is it possible that maybe this summer we'll say, well, it's okay for young people? So are you getting ready to mass vaccinate young people when they go back to school in September? Well, let's look at public health and then we'll look at vaccination. I think that it's a possibility, and actually we believe that we've had discussions with Israel, and they are waiting to vaccinate these groups because there is transmission associated to these people. It's a hypothesis, but we need adequate clinical studies in order to move forward. Pfizer has announced that it's being evaluated by Health Canada, but there will also be other vaccines that will be adequate for younger people, and vaccines that are not yet present in the market that we may have access to by September.
For Mr.
Paré, I'd like to remind you, you know that we now publish once a week to see where we are out of the total of 5.3 million that we must have for the 24th of June. You also know that this 5.3 million does not include the second dose and does not include young people under 18 years of age. So obviously, with the arrival of new vaccines, well, depending on the opinion of public health and what's going to happen, we will certainly have, as of June, enough vaccines to vaccinate that clientele, but we must wait to get the green light from public health. Mr. Paré wanted to add something? Well, to answer your question, yes, we are working on these scenarios, but it'll depend on recommendations from public health. And like the minister said, depending on the arrival of doses, well, that's the scenario that we are working on right now to vaccinate young people if this scenario occurs.
Monsieur Dubé, Monsieur Paré, Dr. Arruda.
Question. So now we've got a calendar for people who are more vulnerable. As of when, in your planning, do you believe that mass vaccination will start, and in what way will it be done? Are we going to continue? Because I imagine that we can't have millions of people who go get vaccinated at the same time. So will you continue to go with age groups, for example, or how will this work? The first answer is soon. Can you be more specific? No, but soon. And once again, we've worked on different scenarios, and we will want to make sure that it's done in the proper order and that things are going well for the time being, and we want to make sure that it continues to go well. We know that everybody is anxious, and I appreciate your question. I'll tell you two things. First of all, I would tell you that the general population is for the end of May. That is the date that we're aiming for. Once we've settled the 500,000 that we mentioned earlier, the 250,000 in categories 8 and 9. So the date that we're aiming for is the end of May. The second thing, we'll see in the next few days and weeks when we can announce when people will be able to register for an appointment. We're not yet ready to do that because we want to clarify the whole question of chronic illnesses, etc. Because I think that Quebecers, and we saw this, not only do they want to know that they will be vaccinated, but they would like to know when. And they want to know when they can make an appointment. We're very conscious of this, but now we have to settle what we had to settle today with chronic illnesses and people living with a disability. And over the next few days and weeks, we will come back to you with more specific dates. But our objective for the general population is the end of May. My second question is more for Mr. Arruda, I imagine. With the emergence of these new variants, and now we're wondering if the vaccines are effective with these new variants, eventually, would that mean that on an annual basis we will have vaccination campaigns as we do with the flu, with different strains of the virus in order to protect the population, kind of like what we do with the flu. I know that you were already asked this question, but what do you think about this? Have you changed your mind, and are we getting ready for this? Well, it's in our scenarios, yes. Obviously, we would like the period to be less frequent than every year for all sorts of reasons. But also, one of the things that's important is that we have to make sure that the planet gets vaccinated. You know, if countries like Africa, like in Africa, don't have access to vaccines, that means we will have more mutations and more strains, and that will catch up to us eventually. But it's clear, and you know, to be honest, you know, we've dreamed of a universal vaccine for the flu for years, you know, a vaccine that we'd get one that would protect against several mutations. But it doesn't mean that we're not going to have that kind of vaccine. It's possible that it won't be annually. Perhaps it'll depend on what happens. The virus could also go away for all sorts of reasons. There's all sorts of potential scenarios, but it's clear that we are looking at this. And it's also clear that probably virologists throughout the world are looking at this in order to make sure that if there's ever a new strain that emerges, that we'll be able to manufacture the vaccine quickly. Now, with genetics, the recipe, you know, is known. Perhaps people have the impression that it took a long time to make the vaccine, but it's extraordinary what happened this time with a vaccine that came out in November. And at the 12th of January, we had the sequencing, and we were able to start the production of vaccines very quickly. What I would like to say as well, in answer to your question and to Quebecers, the good news is that today we now have 11,000 vaccinators who were trained through Je Contribue. You'll remember we had 3,000, 4,000, 5,000. Now we're at 11,000. Today, I take the opportunity to say that we still have some spots available for people who are interested in this. We have published this information. We've got a lot of students for whom it could be applicable. And the reason why I'm mentioning this is that we are getting ready in order to have the staff, the additional staff that will add to our health network. What we will announce with businesses next week, what we want is that during the summer, the vaccinators that we have trained, that they will come give a break to our health staff so that they can go on vacation. So there are two advantages to having increased this staff. It's to support our health staff who will need vacation time this summer and while we vaccinate. And secondly, this staff, and that answers your question, we will now be able to have this agility that we've developed. When you saw the pictures at the Palais des Congrès and elsewhere, and I told you what's important for us is not that they be more or less busy. It's to train people, and by training these people, well, now if we have to have a vaccine once a year, well, it won't be something that is exceptional. It will become commonplace, and we will do it effectively. So there was the training component. I'm very pleased that we've got 11,000, but if we had 2,000 or 3,000 additional people, particularly students this summer, well, I think that we'll take them all on so that we can be even more flexible, more agile in the next few months. Question? I understand that you don't want to go into the general population yet, but you know that this is something that people are anxiously awaiting. Is it the government's intention to give the kickoff for the general populations throughout Quebec at the same time? Because there's some friction, you know, when we send doses to Montreal versus the regions. So is this a concern that you have? Is this a government's ambition to have a kickoff for everybody? Well, we have these discussions with public health, and I appreciate your question. I would like to say that we were able to have a good proportion everywhere, because it's true that we had given more doses in Montreal in the beginning, and AstraZeneca allowed us to send doses throughout all the regions. But give us a few more days, because we really want, like we've done with the chronic illnesses, these are things that are so important to Quebecers. And I would rather we say, well, and once again, it's the visibility of vaccines that makes a difference. I'm repeating myself here, but now that we know that we have this assurance with Pfizer, I would say over the next few days, we will move to the second phase, and how we will do this, I'm telling you that we will start at the end of May, but how we'll proceed, give us a few more days and we'll come back to you with detailed answers. Mr. Dubé, I'd like to hear you on the issue of the N95 in the lukewarm zones. There are some doctors who have written to you to raise your awareness to the fact that it was chaotic, the management of the wearing of the N95. The unions don't want us to back down on this. You've got up until tomorrow to request a revision of this. So what is your intention? The decision was already made, but not by us, but by the Crown Prosecutor to ask for a revision of the decision. That is clear. That was communicated to us yesterday. And I think that now that there's been a decision made by the courts, we will back away from this, but the request for the revision was made yesterday. Question. Mr. Dubé, you were asked twice, but when it comes to not asking for proof of chronic illness, what I'm told is that it's possible to present a list of medications or, well, a list of medications or a prescription. So have you considered that it would just be too complicated, that it would limit certain people if we require proof such as this one? Well, listen, we talked about it quite a bit, and it's so difficult. When I talk about chronic illness and people living with a disability, I think these people already have many things to do with the life that they're leading. I think that they've been waiting for a very long time to be vaccinated. We talked with our vaccinators, we talked with our evaluators, who talk to us about their day-to-day activities. So we have to rely on the goodwill of people. That was our decision. Up until recently, you said that it's possible to find a time outside of work hours, but soon we'll be opening to the general population. So why is it that you reject the idea of creating a vaccine break time, as is the case when there's elections where I think people have 4 hours where they can leave work to go vote? Well, when it comes to comparing this to elections, I've said this. Listen, elections is one day, and it's from this time to that time. Here we're talking about vaccination that is given over several months, and that is given 7 days a week. And we've demonstrated that we were able now to extend our hours. So we're not comparing apples to apples. However, what I would like to say, and I think that, well, first of all, our people, our teachers, or in Category 9 that we announced about 10 days ago, already had a first wave of appointments that they could do. But with the additional vaccines, we will open up some additional appointments. So teachers will be able to go get vaccinated either at night or on the weekend. And so I think that vaccination, or the additional vaccines, allow us to say to teachers in Category 9, you have flexibility to go get some appointments that are at an appropriate time for you. And when we will announce vaccination in businesses next week, businesses will do exactly this. They will follow the same rules that we follow in our public network. So teachers will be able to go into the regions to go get vaccinated on business sites. So there's a lot of flexibility that we've given, and for the time being, we are following the order of priority. Question? Mr. Dubé, I'd like to come back to, and Dr. Arruda, you can answer as well. I'd like to come back to the Indian variant. Montreal having an international airport where there's a lot of travel. I understand that the first Indian variant was detected in the Mauricie Centre du Québec. But what is the level of fragility of the greater Montreal region currently? Before handing it over to Dr. Arruda, I want to tell you, we truly have to have support from the federal. That's the first thing. The best way to stop new variants is that the federal has to support us. We made a request The Premier explained this morning that jointly with other premiers, other provinces, we're not the only. Currently, it's nice to reduce flights from abroad, but you know that there are connection flights. You know, people come from India, perhaps through Toronto, but then they come to Montreal. So we really have to go at the source of the problem, that is international flights. So that's the first thing. And from what I'm hearing, the federal is listening to us, they've been listening to us, and they're trying to find a solution to this effect. So that's the first thing. Now, on the fragility of the situation, I will let Dr. Arruda comment on this. It's a question of probability. Sometimes it's surprising, you know, we had the South African variant in the Abitibi. It didn't appear in Montreal for all sorts of reasons, a traveler or a mine worker, whatever. If we're in an urban region or if we're an international region, there's a greater risk that there'll be a variant. However, the approaches that we have taken to be very aggressive in our interventions will perhaps, well, they'll not stop the introduction of the variant, but it'll stop the transmission of the variant. Currently, it's a UK variant that is predominant. There were a few cases of the UK, or of the Brazilian variant. And the other element that I want to mention as well, there could be a variant that occurs in Quebec. We could have a more severe variant that occurs in Quebec. That's why it's important that the Institute does its random sequencing in all regions of Quebec, in addition to targeting people who are coming back from abroad. The discussions that our colleagues who handle negotiations with the federal government, we've asked that they make sure that we will have stronger restrictions on land, not just with flights. What's happening at the border, you've seen articles in the newspapers over the past few days, people can enter the country, and the variant can come in through there as well, through land border crossing. So that's why we're putting pressure. Mr. Dubé, the INES has published recently a study on emergency departments during the pandemic, and what we're noticing is a significant decrease in visits to the emergency rooms from March 2020 to last February. Today, more recently, what is the picture you have of this situation? More broadly, what impact can it have over the long term? Having seen decreased visits to the emergency department during the pandemic, it's something that we're following very closely with Dr. O'Patterney, because we can say the good news is that we've got a lower rate of occupation in our wait times are better, but that's a result, it's a false result, because either people are not going to the emergency room because they're afraid of getting COVID at the hospital. There's all sorts of reasons that explain this. What we've asked Dr. O'Patterney and Dr. Berger, who's here for the Hôtel Dieu de Lévis, we've got a work group that is only looking at this right now. I'll give you an example. To settle issues in emergency rooms, we are working, and there will be a forum on this in 2 weeks. We're working on the pre-hospitalization. What's happening now with our emergency departments is that often it's a choice of the ambulance to go to such and such a hospital, and it's not always the most optimal choice for that hospital or for that region. So we are trying to take advantage of this situation where there are fewer people in the emergency departments to rethink the system from the beginning to the end, including pre-hospitalization. So I'm just saying that we've created a working group that is led by Dr. Berger from Quebec, under the leadership of Dr. O'Patterney, and we're working on this so that we can come up with solutions, and we want to continually improve the wait times in our emergency departments. I will ask a question. So I've got the list of the group, so hypertension, respiratory, all that, the list, the first list that you had. And I was wondering if in this list, if there were counterindications for certain vaccines that people have to pay attention to before they go get vaccinated? Well, the contraindications of the vaccinations are rare. You know that without it being a contraindication, we have an age limit for AstraZeneca given the potential risk of blood clots, and for the rest, these are people who have reacted to other vaccines. That's not a contraindication. We just keep an eye on them longer, 30 minutes instead of 15 minutes. Or if somebody had an allergic reaction to a vaccine in the past. For example, if somebody had a big reaction following a vaccine, well, the second dose will not be that same vaccine. So there are no counterindications. And Mr. Dubé, concerning the presumed good faith, I understand that you're communicating this message. Were there cases where people pretended that they were somebody else? Or would there not be some cases, for example, where somebody could say that they're autistic and they're accompanied by their spouse? And would there not be a way to check? Well, listen, I will let Daniel answer. It's possible that it occurred. I will let Daniel answer, but I think that, and I said this earlier, I think that Quebecers have good faith, and they can understand that now that we have the vaccines to vaccinate these people and take care of these particular situations, that's why we're relying on the good faith of people. And they will wait for these people to be vaccinated. It's up to everybody to make that decision. I think all Quebecers agree that we're making the right decision now to rely on people's good faith. We have to understand, I think that we have to trust people, most people. You know, if there are some individuals who try to cheat the system, well, you know, that's unavoidable. But I think that the heaviness that it would cause in the clinics is not worth it. And I think you have to remember that soon everybody will have access to a vaccine. We're not talking about 6 months or a year from now. It's a question of weeks. So I think that out of respect for others, there are some people who are at greater risk than ourselves, and we have to respect them. And I think that most Quebecers understand this. If there are a few exceptions, well, they will remain exceptions, but I think that it's important. And it's not like you're going to wait 6 months or a year to get your vaccine. You've got just a few weeks to wait, if not a few days, before you can make an appointment. So I think that that's a way to proceed right now. I think Daniel wants to comment. We don't have any stats for cheaters. Let's put it that way. For people who would present themselves or who were not a priority and got vaccinated. We don't keep stats on this, and I'm not going to repeat everything that was mentioned, but I would like to take this opportunity to congratulate a group that we haven't mentioned as much today. And we talked about the businesses, the projects in businesses, and vaccination, the drive-through vaccination, but I would like to talk about community pharmacies and drugstores. Listen, we've had 20,000 doses administered in our pharmacies every day in Quebec, so congratulations. These are wonderful proximity services. It allows us to have more than, or between 1,400 to 1,500 sites where people can get vaccinated in the province. The pharmacists are close to their people. And when it comes to people with chronic illness, but it's also good for the rest of the population. So once again, to our colleagues in the community drugstores, congratulations and thank you. I'm happy that Daniel is talking about pharmacists because we've got several examples right now, especially over the past few days, where it's pharmacists who are calling their clients. So the best way, you know, these people, they know their clients. They know who's got a chronic illness. They can call them and say, listen, over the next few days, here's the number of additional appointments that we've got, and come get vaccinated. So it's not just that people are going to our vaccination centers, but the pharmacists are calling their clients, and I appreciate that because it wasn't easy. They had some difficult moments over the past few days, you know, with the cancellation of the Moderna vaccines. They had to get organized, so I think it's important to congratulate them today. Last question in French. Hello. We learned this afternoon
Madame Crête. Allô?
Mrs. Crête?
Je suis là, j'avais oublié d'ouvrir mon micro, désolé. Alors, bonjour. On a appris
We learned this afternoon that Canada will not receive the million AstraZeneca doses that were expected this month from India, and I was wondering what impact will this have on the vaccination campaign in Quebec? Well, we heard the news at the same time as you did. All the announcements that we're making today are based on the Pfizer doses. So there's no impact on everything that we've announced for May and for our objectives to vaccinate everybody by the 24th of June. So I'd like to reassure you. It's never good news to hear that we're not going to get vaccines. I want to be clear on that, but there's no impact on our objectives. Will it have an impact, for example, for the second doses? Because a few months ago, there were some people who had started to get the AstraZeneca vaccine. We will follow it closely. Once again, there are other vaccine announcements that are coming. That's what we were told by the federal government. And we will take into account these future doses of AstraZeneca to keep the second dose. But there's a plan B. We always have to be ready. And I don't know if Dr. Arruda, you want to say anything? We're looking at the possibility of making the vaccines interchangeable, so getting one dose of one vaccine and then a second dose of another vaccine. The studies are ongoing throughout the world, and perhaps there could be some advantages to combining two different vaccines. So without pronouncing myself on this right now, there will be a way to manage the situation if there's a lack of vaccines, because we always have alternatives. But we will only do it if it's safe, if it's adequate, and if it protects well. We will now go to the English questions.
Hello, I would like to touch on the question about pregnant women again. Why not prioritize pregnant women who don't have chronic illnesses, knowing what we're seeing in Toronto and ICUs with a higher number of pregnant women showing up there in the third wave?
Okay, yes. We have not observed the same phenomena that in Toronto, actually, but I think, and as I was telling you, now we're beginning with the chronic person, the people who are chronic disease as a first step, because they have a higher risk than the others pregnant women. Soon, as I will tell, we will open to almost everybody, and the fact of being vaccinated when you're pregnant is something that you must discuss with your doctor. There is no risk, really. There is no theoretical risk, but it's related to your risk of exposition. There is probably healthcare workers who have been vaccinated because they were in exposed situation, but I think that pregnant women in Quebec will be offered vaccine by the steps. Our choice has always been limited by the quantity of vaccines. We went always to the ones at higher risk to lower risk. I'm not telling that pregnant women are not at risk at all. They are more at risk than a non-pregnant person, but they are not as risk as elderly ones that we vaccinate first.
I also have a question about the AstraZeneca campaign, the rollout, and how that's going. It doesn't seem like there are many appointments or any appointments left to take. How many doses are left? And if you're a 45-year-old, for example, and you missed the boat this week, does that mean you have to wait until the end of May, or is there a potential for another delivery of AstraZeneca?
Daniel?
Well, depends where you live. In Quebec, there are some regions, just like you mentioned, there's no AstraZeneca left or no appointments left, which is a good news. And there's some other region, such as Estrie. If you live in Estrie, there's some AstraZeneca still available in that region. And actually, if there's rumors that we will get more AstraZeneca from direct from the provider, or some lease from the USA. We're still waiting for some confirmation on that.
And in terms of how many doses are left throughout Quebec, do you know?
Well, this morning was less than 200,000. And every day, as you mentioned, I mean, all the appointments are almost confirmed. So there will be no AstraZeneca left probably in 4 or 5 days.
Cathy Sonnet, CBC.
Good afternoon. Mr. Arruda, I would like to go back to switching the vaccines between the first and the second dose. How confident are you that this will be efficient, or do you have the impression it might diminish the efficiency of the second dose if you switch?
We have a lot of stories of even better immunity with different vaccines, because sometimes they go stimulate a part more than cellular immunity comparing to humoral immunity. So actually, based on science, what has been studied, we try to do the same vaccine that was in the protocols. But I think that if you have received Pfizer one, you could receive probably a Moderna. If there is no available Pfizer and you have Moderna, I think the recommendation will be you can change it. And what will be another thing to look at is that have you had mRNA vaccine? Would you had like one of virus variant like AstraZeneca combined? We need to do studies. But sometimes I would say most of the time the probability of having a good immunity is there.
Okay, and even stronger, as you said. Okay.
But as I'm telling you, we need to have more studies to be more confident on that.
Okay, and regarding the fact that this press conference, Mr. Dubé, was planned, and then in the meantime we had this confirmed new variant first found in India. How crucial is it today with having new variants in Quebec to extend this definition of chronic illness, so to have more people in this category to be vaccinated soon, and also having intellectual disabilities, for example, people having autism, to be vaccinated ASAP, regarding the fact that we have new variants and we don't know everything about them?
I think Dr. Arruda can complete, but I want to make sure I understand your point. I think what I would like to say, the biggest decision, and this is why we're so pleased with the announcement today, is that we have additional vaccine. The driver, when we accelerate certain groups, as we do today, is because we have additional vaccine. Now, does that protect better if there is a new variant? I would say not necessarily, because one of the points that Dr. Arruda said, in the case of India, depending, we have, can I say, is not as effective from the other vaccine that we have right now. So that's the reason I'm saying we have new vaccine, let's go. But I think we need to be very prudent with the Indian version that we have right now. So I think we're driven by the number of vaccines.
I may add, if you don't mind, is that, first of all, the decision of making vaccination in a fast way is not related to any variant. Even if we had on the old variant, we would have done the same thing. The limit was the quantity of the vaccines, because even if we don't have variants, we should have done the same thing. So there is no change on that. But what it makes is that you must also accompany vaccination of the measures. Because actually, this new variant, we need to do a good contact tracing, making sure that we isolate them for not letting that variant taking the place. And if this variant is more transmissible or have more mortality, morbidity, or cannot be prevented by vaccines, that's not the time to have this explode, actually. So it's why I would say we will need you to maintain, I would say, the measures that are needed. And I want to make an information too. We have talked a lot about outbreaks in schools, which is a reality. And we know there is a risk of to outbreak in schools. And we decided to open them because it's important for kids. Not going to school is a bad thing for them. But we are seeing now in the regions where we put the mesures d'urgence, a high rate of, I would say, outbreaks in workplaces. So I just want to say that we have seen in Quebec City, in Chaudière-Appalaches, in Outaouais, a very high level of outbreaks in, I would say, workplaces. So it's very important to don't forget the measures that must be put in place in workplaces, especially when you dine with other colleagues, and making sure that we use the masks and make the good hygiene protocols. So don't remember, I will repeat that forever. Distanciation of 2 meters, wash your hands, use masks, and vaccination.
Une toute dernière question maintenant de Raquel Fletcher, Global. Madame Fletcher?
Good afternoon. My first question is for Mr. Dubé. Last week, a lawyer representing a group of families of people with intellectual disabilities sent a letter to the government demanding that their family members be prioritized for the vaccine. What influence did that letter have on your decision to include these individuals in the vaccine rollout now?
Well, I think we were sensitive to that even before this letter. As I mentioned today, I think that we all recognize the need to protect those people as quickly as possible. And the good news is that we can do it today with the announcement of additional doses of Pfizer in the last few days. And that's the reason we're so happy to make this announcement today.
My second question is about the variant that we're seeing from India. I want to know how big of a concern is it that we're now seeing another new variant? And you also mentioned your concerns about traveling. Why is that important?
I'll start, and Horacio can talk about a bit the new variant. But I think that we all understand, and this is coming from the first wave, how important the control on our borders, it is important, especially with what you're mentioning about this new variant from India and also from Brazil that has been coming from, notably from BC, I say notably. So that's the reason we are in very tense discussion, intense discussion, I should say, with the federal authority, and I think they're very sensitive to our demand, not only to protect our borders in the airports, but also at the borders by way of cars. So I think I understand that those discussions are going well right now, and that's probably the best way to protect ourselves from additional variants right now.
And I would say that what is good, if I can say, is that we detect rapidly those variants here in Quebec by our sequencing and criblage strategy. And also, I think we must keep the measures in place because of those variants. We should have some constraints, I would say, on borders from the ground and also, I would say, by airplane. And it's what is getting now. And we should also understand that we have this program to make sure that we'll detect too. There could be a variant that will appear in Quebec per se or elsewhere in Canada. So I think we knew this virus was going to mutate. We have the systems to detect them, but the strategy we're using for controlling the outbreaks are good for controlling also the variants.
C'est ce qui met fin à cette conférence de presse. Merci, messieurs.
Merci beaucoup. Merci, bon week-end.
Vous aussi.